All right, in this portion of the video, we're going to discuss allergen immunotherapy, or more commonly called the allergy shots. If you're watching, it's either been recommended for you or you're considering it. How do allergy shots work? Well, as we talked about in the first segment of this video, people with allergies make a specific antibody that causes the allergic reaction. It's called the IgE antibody. And about 20% of the population has sort of a genetic predisposition to making those antibodies. So in order to become allergic, you need two things. You need that genetic predisposition to make allergic antibodies, and about 20% of the population have those genes. Allergies do run in families. And you need exposure to the allergen. So if you have a gene that makes you prone to developing an allergy to, say, grass pollen, you will develop those allergies with several seasons of exposure to grass pollen. If you never get exposed to grass pollen, you'll never develop the allergy symptoms. So for those of you watching now, I'm assuming you already have symptoms and you've been told what you're allergic to. How do we treat it then? Well, we're going to focus on that IgE antibody and see what we can do about reducing that or blocking those allergens from getting to the IgE antibody. When you inhale an allergen like dust mite particles or pollen, your immune system is going to view portions of those particles as foreign bodies trying to invade your body, trying to get in. And those IgE antibodies are going to initiate what we call an immunologic or allergic response to try to prevent that foreign material from getting into your body and get rid of it. So how do we do that realistically? What kind of symptoms occur? Well, if you're inhaling it through your nose is going to stop up because you're going to try to prevent, your body's trying to prevent it from getting in. Your nose is going to start running and you're going to start sneezing to try to get rid of it. If it gets into your eyes are going to start tearing and itching to wash out that foreign material. If it gets into your lungs, it may cause wheezing. So your lungs are going to shut down to try to prevent that material from getting in. So in this case, the immunologic or allergic response is causing worse symptoms than inhaling those things would normally cause. And about 80% of the population can inhale those materials and have absolutely no symptoms at all. What we try to do by giving you the allergy shots is to convert your immune system to where you no longer make those IgE antibodies and you start to make what we call a protective antibody or an IgG antibody. Over a period of time, you receive subcutaneous injections of the allergens to which you're allergic. You start at a very low dose and gradually increase it every few days or every week until we get up to what we call the maintenance dose. When we achieve that maintenance dose, your body has probably already started producing another type of antibody to those particular allergens. And that antibody is called IgG. What the IgG is a protective antibody. So now when you inhale that grass pollen that you're allergic to, that IgG in your system is able to grab onto those particles and block the IgE molecules from getting to them. By doing that, we prevent the allergic reaction. So as I said earlier, it's the closest thing we have to a cure, although we can't honestly call it a cure. Over time, your body forgets how to make that IgE or allergic antibody, and we oftentimes see long-term relief of symptoms even after stopping the allergy injections. We usually recommend that you remain on the allergy shots for 3 to 5 years, at which time we retest you to see if we've got rid of those allergic antibodies permanently. Now, how we get the injections is, of course, of interest to people who are going on to the therapy. As I said, it is an injection, and it's usually given in the back part of the upper arm. It's a subcutaneous injection given with a very fine needle or an insulin needle. And initially, we get those injections usually once a week, sometimes twice a week if people want to build up faster. As I said, each time you come in, you're going to get a little bit higher dose. We can't give you the full dose on your first visit because we're injecting you with something you're actually allergic to. So we try to induce a tolerance by gradually increasing the dose and building you up to what we call the maintenance dose. And that's where we'll see our effect from actually getting the allergy injections. You'll usually see some response within a year and peak effect at about 2 years in terms of relief of symptoms with the allergy injections. While you're on the injections and building up on them, we recommend you remain on your allergy medications. Now, as with any medication or therapy, there are potential side effects, and I want to go over those with you up front. The most common side effect that we see is swelling at the injection site. And this is not of great concern, but can be a little bit annoying because the swellings can get large. There are things we can do to reduce that. This does not occur in most patients because we start with a small dose and build up gradually, but in patients who are very sensitive, we see some swellings, and they may be the size of a quarter, they may get to be the size of a baseball. If that happens, there are things that we can do to reduce that, and we'll talk to you about that if necessary. As I said, this does not happen to most patients who go on allergy shots, and if it does occur, there are things we can do like increasing your antihistamine dose on shot days or putting a little bit of adrenaline into the needle before we give you the shot to reduce those reactions. The second reaction is a more severe reaction. It's what we call anaphylaxis. And this is a full-blown allergic reaction where we can get swelling of your throat, hives all over, wheezing if you have asthma. This occurs very rarely, again, because we gradually increase the dose each time and don't give you too high a dose initially. This is also why we want you to remain in the office for about 15 to 20 minutes after getting your injection to ensure that you don't have a severe reaction. And if you do, we can treat it. Again, the incidence of this occurring is extremely low, and I would encourage you to speak with your physician about it before you begin the immunotherapy so you fully understand it.